Okay, so just demonstrating how we're going to use a Pocket Physio Max or a trigger ball if you've got one, but I like these certainly for it. Just to trigger point the lateral hip, some muscles that we often find trigger pointing helps with a lot of lower back as well as lower limb pain. So the first spot we're targeting is the TFL. So if you find the bony part at the front of your pelvis called your ASIS, we're going to work a little bit lateral, a little bit inferior to that. So 2 centimeters out, 2 centimeters down is good for most people. We're aiming that spot for the point of our Pocket Physio. Now the leg setup is pretty important here. So the point of that on that spot, take your top leg, bring it up so that the knee is about in line with your hip, and make sure it's touching the floor so you are a bit rotated down. You'll start on your elbow, and that shouldn't be too sore. But from that position, as you then relax down and hold in that position, you're looking for a spot that radiates pain, typically down the outside of your leg, even as far as your shin, but certainly in and around the pelvis and up into the lower back. If you don't quite feel that, that's okay. Have a little play around. So move a centimeter lower, a centimeter forward, a centimeter back if you need to. Muck around with the angle of where that knee is relative to your waist, but you should find a spot that's pretty sore and shooting some pain. Now hold that for about 30 seconds. What you're looking for is when the pain is settling down and then it's finally plateaued or bottomed out. Once that's done that, you're gonna come up, slide yourself along so that it moves about a centimeter or two closer down towards your knee in that same orientation again. And again, relax into it. Let this bottom leg stay floppy. Wait for that pain to dissipate. Again, after you've done that second, it's one more, exactly the same, down towards the knee about a centimeter. Lying down, letting that release. So that's the TFL, or the front part of the lateral hip, done. From there we can roll off the Pocket Physio into this orientation. Foot goes on the floor behind us, Pocket Physio will pop out and we're up on our elbow. I want you to lift your hip up. We're looking for the space between the crest of your hip and the bony bit on the outside of your hip. We're targeting the glute medius, minimus, just the lateral fibers of our glute. Max as well. And again, just sinking in, less specific on the location here. You're just looking for something that's going to typically radiate some pain either across into your buttock or down the hamstring in the back of the leg, but it's exactly the same process. 30 odd seconds to maybe a minute at most, good for most people. But when you notice that that pain has subsided, it's feeling a little more tolerable, it's time to move along. Again, work just across, closer towards the tailbone, anywhere from that side of your hip right the way around to the middle of your buttock. Cool.